Everyone. Wonderful. We all set, Natalie?
Yep.
Okay, terrific. Well, welcome everyone. My name is James Orbinski. Do we have anyone online?
Yeah, we're letting them in now.
Oh, perfect. Thanks. Behave. Anyway, I'm just going to continue. So my name is James Orbinski. I'm the director of the Dahdaleh Institute for the next few months, and then Mary Victoriowicz will become, we hope, the interim director. And today we have a really wonderful speaker, Dr. Syed Imran Ali, who is going to be speaking about safe water optimization in refugee camps and internally displaced persons settings, and the technologies that we have developed here at the Humanitarian Water Engineering Lab to optimize safe water and therefore reduce pathogenic waterborne pathogenic contamination of water with massive impacts in terms of morbidity and mortality. But before we get there, I'd like to begin our seminar with a land acknowledgement and an acknowledgement of the land that we're actually physically on. And some people are hybrid, so they're on Zoom and on different physical lands. And this is a good moment to reflect on virtual versus actual. This is about actual. I encourage people, excuse me, who are joining us virtually to take a moment to acknowledge the actual land that they are on, just as we're going to take a moment now to acknowledge this actual land. And this, today we're here at York University campus in Toronto. And York University, this is the traditional territorial area known as Takaranto. And we acknowledge its current treaty holders, who are the Mississaugas of the Credit First Nation. We also acknowledge that this is the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, Huron-Wendat, and of course the Métis. And the territory, the land that we are on, is governed or subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peaceably share the land and also care for the land and for the Great Lakes region. And we can extend that desire to share and to care for the land that we're on, and for each other on that land, because that's also inherent in the land acknowledgement. We can extend it to what Imran's going to talk about today, which falls under our global health and humanitarianism theme, which is our effort, our best effort, to create research, policy, and practice that focuses on humanitarian needs in a global health context. And I can't think of a better, more practical example of that than what Imran has led and is currently leading at the Humanitarian Water Engineering Lab around safe water optimization tools. So I'll just tell you a little bit about Imran. Imran is a highly experienced aid worker, has a PhD in engineering, spent a year, I'm not reading this, this is just from my memory, spent a couple of years, or just under 2 years at Berkeley, California, as a postdoctoral engineering fellow. He has worked for many years with Médecins Sans Frontières, or Doctors Without Borders, and the UN Refugee Agency, or UNHCR, in South Sudan, in Pakistan, in Jordan, Rwanda, Uganda, and many other countries around the world. He is primarily a water engineer, and he's one of the leaders, not only in MSF, but in the international community of water engineers. He's one of the thought leaders and also one of the practice leaders in humanitarian water engineering for many different agencies, including MSF, Red Cross, OCHA, UNHCR, and so on. So here at York, Imran directs the Humanitarian Water Engineering Lab here at the Dahdaleh Institute, and he's also an adjunct professor in the Lausanne School of Engineering. And I could say so much more. There's lots of details here, in terms of research grants and all the stuff that academics value. Lots of research grants, lots of research dollars, kabillions of publications, all very practical and concrete outputs. But what is, I think, most important about Imran and about what we're trying to do at the lab, which he directs, the Humanitarian Water Engineering Lab, is that we'd never forget that the technology and the science is about human beings and relieving suffering in the most difficult circumstances that we can possibly imagine. Nobody wants to be in a refugee camp. Nobody wants to be internally displaced. And yet, in those very difficult circumstances, they face very specific problems. And one of the big problems that they face is water contamination. About 58% of all mortality in a refugee camp or an IDP setting. Now, maybe not quite as high in an IDP setting, but about 58% of all mortality in a refugee camp setting is due to waterborne infectious disease, which is a 100% preventable problem. So what I love about Imran is he is completely focused on relief of suffering, prevention of preventable disease, and doing that with a very, very practical, tool-oriented mindset. So what he's created under his leadership, the Safe Water Optimization Toolkit, he's going to tell you about that. This is now being used in refugee camps, many different, about 9, I think, in different parts of,
9 countries.
9 countries around the world. It has been and is being field tested. It's already proven its validity and its efficacy, and we're now working on the next generation of safe water optimization tools, which will have even more impact. I hope, Imran, you will talk a little bit about the lab and what you're doing as director for the lab. The lab also includes a whole teaching program for mid-career or practicing humanitarian water engineers. We offer microcredit courses for practicing humanitarian water engineers. We have thousands of applicants, far in excess of the space that we have capacity to actually support. And we are growing that suite of courses. We also are starting in partnership with Lausanne School of Engineering here at the university, a special master's stream program in humanitarian water engineering. And Imran is, again, leading that and leading the pedagogy, teaching, and so on, and the structure of that program. So we'll stop there, but just say that this is an example of highly, highly principled and pragmatic, critical problem solving for greater effectiveness, equity, and excellence in global health research, policy, and practice. And do you hear an echo? That is the mission statement of the Dahdaleh Institute. So with that, over to you.
Thank you, James. So very, very much. Sort of get tired hearing that. I'm like, oh, I got so many things to do. I'm so behind.
But they're all good, right?
Well, thank you so much, everybody, for being here. I'm going to share my screen. If this works, okay. Great. So, I'm going to talk a little bit about the safe water optimization tools that we're developing. But really, what I as global health students in the room, I really want to frame the problem space that we're looking at for you guys. So I want to talk a bit about the scale of humanitarian crises that we face in the world today. And then I want to talk a bit from the disciplinary perspective that I come from of water and the role that water has to play for health in these high-risk settings. And through that, I'm going to introduce the Humanitarian Water Engineering Lab and the work that we do, which James has done a wonderful job introducing. And I want to use that as a jumping off point to put out some ideas about how do we collectively, as global health workers, as engineers, as medics, as humanitarian responders, how do we work in solidarity with people? What does that mean? What does that look like? I want to put some ideas out there and maybe have a discussion, get your reflections on it, and yeah, see if we can chart a pathway forward that's based on principles of solidarity rather than saviorism and do-gooderism and stuff like that. So yeah, that's the plan today. So let me begin with context. Where are we? I think everyone in this room is very well aware of the news. The world is in a mess, right? And it's been in a mess for a little while now, for some years now. Right now, 1.5% of the world's population, the entire global population, is displaced. It's forcibly displaced, and in need of protection and humanitarian assistance. So we're talking about 120 million people. Right? This is the highest level that's ever been recorded. And this global crisis of displacement is being driven by conflict and climate. Estimates right now are that 3 out of 4 forcibly displaced people are living in countries with high to extreme exposure to climate hazards, and 1 in 2 are living in countries exposed to conflict. So conflict and climate are really the forces that are driving this. When we talk about numbers and global scale, we kind of lose sight of like what that actually means for people. And whenever I think of those numbers, I think about this poem by a Somali British poet named Warsan Shire called Home. Because it reminds that people only leave home when there's no other option. When to stay means that they may not survive where they are. And she writes in that poem, it's a much longer poem, this is a fun small part of it. She writes, you have to understand that no one puts their children in a boat unless the water is safer than the land. No one burns their palms under trains, beneath carriages. No one spends days and nights in the stomach of a truck, feeding on newspaper, unless the miles traveled means something more than journey. Where do people journey to when they're on these movements? The places that people have to flee to are necessarily on the edges of survivability. It's a unit of geographic distance between living and not living. That's why they have to. Right? These margins of survivability are today being pushed outwards into ever greater swaths of the global population by changing climate, by growing conflict, by social and economic dislocation. And when people are forced to flee and are displaced, the normal functioning of life falls away. Right? Everything that we take for granted becomes a matter of survival. Right? People need protection, they need food, shelter, medical care, water. All these are the essentials that are the central focus of humanitarian response. It's what we try to provide to people to sustain their lives in this situation. Now, amongst these life-preserving essentials, water is unique because it cuts both ways, both when there's too much of it and when there's too little. Displaced people, especially in refugee and IDP camps, are uniquely vulnerable to this duality because they're so exposed to the world. These photos you see here are taken literally months apart in the same refugee camp in South Sudan, where I had worked in some years ago with MSF. This situation for me exemplified more than any other place that I've seen in my life, this duality of water and what it means for displaced people. For part of the year, there's acute water scarcity, right? People don't have enough to drink, to maintain hygiene, to water their livestock, and diseases like trachoma, dysentery, scabies, and others stalk the population. When the rains come, it comes in huge waves, and this part of the world is a vast floodplain from the Nile, so it floods everywhere, including flooding latrines that you see in the back corner onto the surface. So this is a perfect storm for all sorts of waterborne diseases to spread like wildfire. In both of these cases of flood and drought, it's the threat of infectious waterborne diseases that looms high. And James pointed out, it's one of the primary drivers of mortality and morbidity in displaced versus settles. So people have started to study this, and this figure you see here comes from a 2019 paper by Chiara Altari at the Johns Hopkins School of Medicine. It looks at infectious disease outbreaks in refugee camps globally between 2009 and 2017. It shows us which infectious diseases have the greatest number of cases during outbreaks in emergency settings. I hope you guys can read this, but of these infectious diseases, which do you think are waterborne? Was is that
Then,
dengue? Okay, that's an option. It's not exactly waterborne. It's water something else. I'll explain that in a moment.
Hepatitis E,
Hepatitis E,
cholera.
cholera, definitely.
Will all have something to do with water.
It has something to do with water and sanitation in some way, but some of them are directly transmitted by water itself. Therefore, waterborne diseases.
that's called
Cholera, yeah. Pure body diarrhea, hepatitis C, acute jaundice syndrome, which is often hepatitis C, but maybe have different etiologies. Giardiasis, Shigella, polio, which we're seeing a resurgence of now in Gaza, already been eliminated because of the destruction of water sanitation systems. There's now an infant who's paralyzed because of polio. Of the top 5 diseases causing outbreaks, burden in refugee camps, 3 of them are waterborne: cholera, water diarrhea, and hepatitis E. And many others contribute a significant burden as well. What's really important to keep in mind with this figure is that this is from the UNHCR Health Information System, so it's only recording outbreak situations. It doesn't cover the slow burn of endemic diseases, which also have a significant mortality morbidity in this population. What we also know is that many of these diseases are expected to become more widespread as climate changes because of changing vector ecologies, rising temperatures, and increasing floods and drought. We know, for instance, cholera outbreaks are linked to increased water temperatures. And we are in fact seeing this happen already. It's been a major upsurge in cholera cases globally since 2021, which we're still in right now. So somebody alluded to dengue fever. All of these diseases you saw are in some way related. Dengue is not exactly a waterborne disease. It's what's called a water-related disease. So there are 4 major classes of infectious diseases which are related to water in some manner. So a waterborne disease are those diseases in which the water carries that infected pathogen from one person to the next, right? And that's, we're talking about cholera, typhoid, hepatitis E, giardiasis, etc. There are also water-related diseases, which are diseases spread by vectors and insects that live in or close to water. So dengue or malaria in the case of mosquitoes, right? Water-based diseases are those that have an infecting agent that's spread by contact with or ingestion of some other infecting agents part of the life cycle. So an example of this is aquatic snails in water supplies that can infect people and spread schistosomiasis. And then there are the water wash diseases, which are diseases linked to lack of adequate quantity of water for maintaining proper personal hygiene, the lack of sanitation in the environment. So trachoma and scabies and other. It's the waterborne diseases and the water wash diseases that impose a significant burden on displaced and conflict-affected communities, whereas water-based and water-related diseases kind of affect everybody broadly. So how do we deal with waterborne diseases, considering the significant burden they impose on displaced and vulnerable populations? Waterborne diseases are also known as fecal oral diseases. Anybody want to hazard a guess why that is? Has anyone heard the term fecal oral disease before? Yeah, everyone's nodding.
Just, yeah, like, yes or no? Yeah, people know what that is? Yeah,
Yes.
okay.
Okay, great. So the reason it's called that because the pathway transmission is from the feces of an affected person to consumption by the next victim of the disease, continuing that cycle of illness, right? This diagram is called the F diagram. Maybe you're familiar with it. It's really important for any WASH practitioner because it shows how those waterborne pathogens move through the environment from an infected person to ingestion by a new person, right? And it's called the F diagram because the pathways they work can all start with F. So fluids like drinking water, fingers, so direct unsanitary contact, flies moving contaminants around, fields, so direct environmental contamination, floods and surface water more generally, and then food, contaminated food. These are all the pathways that these pathogens travel. Now, preventing the transmission of these diseases means interrupting these pathways. And we do that through water sanitation and hygiene interventions, right? So water interventions aim to increase the quantity of water available and the quality of the water that's available to people. Sanitation interventions aim to isolate and contain feces from the environment, and hygiene interventions aim to protect transmission from hands, food, and person-to-person contact. The F diagram shows us which of these pathways these interventions can interrupt and break. And there are both primary and secondary wash interventions. The main primary intervention for wash is sanitation because it contains feces that prevents it from getting out to the environment. However, once that's failed, then you have to rely on secondary barriers. If you already have contamination in the environment, then you have to use secondary barriers to prevent fecal oral pathogens from getting to people once the environment is contaminated. That's hygiene and hand washing and drinking water treatment and safe storage. That's really important. Now, the global burden of disease that's associated with unsafe wash is really immense. A recent paper in The Lancet by Jennifer Wolf at the WHO and colleagues showed that safe wash can prevent an estimated 1.4 million deaths per year and 74 million disability adjusted life years. So a huge mortality and morbidity burden associated with wash-related illnesses. One question that naturally comes to mind when we think about the F diagram and waterborne illnesses is which of these transmission pathways matters most, because that's where we want to target our action, right? There's a recent study done in rural Madagascar by Poulin and colleagues at Acquia, which showed that in children up to 2 years of age, between 27% and 31% of exposure to E. coli, which is an indicator of waterborne pathogens, was due to the drinking water pathway, with cooked food and hand-to-mouth contact being other important contributors. But that was one study, and they looked at a bunch of other studies in that paper, and it showed there's a great diversity of pathways in different studies. Hand-to-mouth unhygienic contact, soil ingestion, animals in the household or in the house unit, contaminated food, contaminated environment, drinking water. They're all factors in different settings, right? Overall, what that tells us is that those different exposure pathways are going to be context specific, and you can't generalize which one is most important or not. And we see that multiple pathways are always active, right? Another way of asking this question is asking what interventions are most effective. And that helps us answer the question, where should we direct our energy? Are some wash interventions going to be more effective for preventing waterborne diseases than others? There's a great meta-analysis, also by Wolf and the WHO, published in The Lancet, looked at 124 individual studies and assessed the effectiveness of wash interventions on the risk of diarrheal disease in children across low and middle income countries. It found a very strong effect for point-of-use water treatment, as well as improved drinking water supply on premises, like very significant reductions in diarrheal disease. Sanitation interventions also had a very strong effect, and household sewerage connections have that an equivalent size effect with point-of-use water treatment. Hand washing with soap is also very, very important. So we see a picture emerging here, which is that safe water, particularly at the point of consumption, close to where people are consuming it, that's really what matters. Sanitation, especially household sewage, so very contained sanitation, very effective for control. And hygiene is sort of the glue that ties it all together. We see that water has an important role, but it's not sufficient on its own. You need all the components to make to prevent these diseases. So we need integrated wash interventions ultimately. So how are we doing globally on water and sanitation coverage? This week, okay, sorry guys. The UN is having its General Assembly, and a lot of these numbers are being discussed. SDG 6 deals with access to water and sanitation. Generally speaking, we're doing better on water than we are in sanitation. Sanitation has always been the poor cousin to water, and I'm guilty of that as well. So right now, the estimates around 2.2 billion people lack access to safely managed drinking water, and 3.5 billion people lack access to safely managed sanitation. But these are very broad estimates, and only about half the countries of the world have data on this, so there's a lot of assumptions at play here. There was actually a paper published just this week, which looked at geospatial modeling using existing surveys and try to fill in those data gaps. And when they fill in those data gaps, they found that the number of people who are actually lacking access to safely managed drinking water services is probably double what the UN estimates are. So the gap is still immense, right? The gap is immense, and the disease burden associated with it is immense.
That's this week.
That's this week, September 21st in Science. So we can see that water remains a big gap, and how much impact could it have to address? last year, Michael Kremer, who's an economist at University of Chicago and the National Bureau of Economic Research, they did a really interesting meta-analysis of a bunch of RCTs, randomized control trials, looking at what effect does water treatment interventions have on child mortality across low-income countries. What they found is that across those studies that they pulled together and conducted a meta-analysis on, was that you could expect a 25% reduction in all-cause child mortality through water treatment interventions. They're economists, so they're very concerned about the question of cost effectiveness, right? And we have certain kind of thresholds we use to to evaluate whether a risk is acceptable or should we invest in an intervention to improve a health risk. The cost effectiveness of averting through water treatments, an individual daily is 40 USD, which is 45 times lower than the standard threshold. So it's an incredibly cost-effective intervention for reducing child mortality. But it's somehow it's been neglected in the suite of child health interventions that are deployed globally. So hopefully this paper changes some minds amongst economists who make these decisions. So far, I've only talked about microbiological water quality. There's a whole other world of chemical water quality, right? And a lot of the parameters that naturally exist in water, chemical water quality parameters in the water, can cause both acute and chronic health risks. And they can both be naturally occurring or they can be anthropogenic, right? And there's many examples of chemical water quality concerns. You can think of lead in Flint. There was lead in Zamfara, and where artisanal gold mining was happening that affected people. MSF did some research on arsenic, fluoride, many others. There's also very innocuous water quality parameters, like dissolved salts in water, that can affect highly vulnerable populations. I mean, things that we take for granted, like the sulfate concentration and sodium and stuff like that, usually stuff we can all handle. But for certain populations that we encounter in humanitarian settings, like pediatric patients with severe acute malnutrition, those innocuous water quality parameters can be potentially life-threatening. So there's a lot to unpack in chemical water quality and health as well. Now, at the Dahdaleh Institutes, we're trying to make a small contribution to this effort. The Humanitarian Water Engineering Lab is leading research to help get safe water to people who need it most and address these neglected and hard to reach populations and their water and health challenges that they face. What our goal is at the lab is to be a bridge between the humanitarian sector, between affected communities and responders, and the engineering and health researchers and other researchers in universities. We want to pull the questions and priorities from the field to meet the skills and expertise of the university and build projects that bring these people together. James mentioned our Safe Water Optimization tool and soon-to-be toolkit. The Safe Water Optimization tool is our flagship at the Humanitarian Water Engineering Lab. It's a water quality modeling platform that uses cutting-edge machine learning and process-based modeling techniques to take regularly collected data that's widely available in the humanitarian sector already, to generate site-specific and evidence-based water treatment guidance that actually ensures water is safe to drink in humanitarian emergencies. This work comes out of my own field experience with MSF, where I discovered some years ago that we have all these standard guidelines we use in humanitarian response. They're not based on any evidence from field settings. They're often just conventions for cities dropped into refugee camps, radically different contexts. They don't work. They don't protect public health. So we're trying to build guidance that actually protects public health based on evidence from these settings. So the Safe Optimization tool is a free and open source tool. It lives on the web that people can upload their routine monitoring data to and generate this site-specific guidance for their water system. So far, it's been deployed by some 7 humanitarian organizations at 16 sites across 9 countries as part of water systems serving 500,000 people. We continue to scale it up globally and integrate it into the standard ways of working to humanitarian response. Another area that we've been working on is on the interaction of chemical water quality and severe acute malnutrition. So that's what I just described to you. This is in response to questions that emerged from some of our field partners who've been working in food and water scarce situations of famine. And they've been finding that there's these unexplained mortality clusters occurring in these intensive therapeutic treatment centers in very water scarce regions. And they couldn't figure out a reason why that's happening, but they noticed that when they switched their water source away from groundwater, those mortality clusters dived off. So we convened some research. We brought together a bunch of experts from nutrition, from pediatrics, from nephrology, from risk assessment, from engineering, to look at this problem together and generate some preliminary guidance, to do a systematic literature review and then generate some guidance. So we have that guidance out. It's with MSF. They're using it in the medical facilities now, and we're putting together some papers and on it now, which I hope to get to soon. Another thing I want to say about that is actually, I'm sure you've heard like the level of famine and food scarcity in Gaza is incredible. They're getting a huge number of deaths of children. And the thing about malnutrition is that even when food is available, they're still at very high risk. Like food is a medicine for malnourished kids. So the feeding regime has to be very carefully managed medically to ensure that people don't die during the refeeding process. That's going to be a huge, when this thing ends, if hopefully it ends soon, in Gaza, there's going to be a huge population of malnourished kids. The water in Gaza is all very deep groundwater, very highly salinated because of seawater intrusion. That's the water they're going to use for producing those therapeutic food products. So there's a very clear risk to that population that we need to get ahead of when there's an opportunity to actually do feeding programs at scale in Gaza. James mentioned some of the training that we do. So another area of our work in amongst the research technology development is training the next generation and current practitioners of humanitarian responders. So we're running the Humanitarian Water Engineering course. Dr. Waters, soon to be, was in it previously. It's now in his 5th offering.
And that is actually his name. I want just as an aside.
Master Waters.
My apologies, Master Waters.
Went to a anesthesiologist. And so first their name was Dr. Payne. So, and a proctologist whose name was Dr. Butt.
I believe that.
Oh, it's true.
Scary, probably. So we're in the 5th offering of this course. It's focused on a water supply, very practical oriented. We have a mix. Mostly we have people from who are active humanitarian responders who've never had a chance of any formal training. So we focus on the techniques for their particular work to upskill them. And then we try to bring engineers and other technical workers into the sector through this course as well. So huge uptake, thousands of applicants. You can only, meet a few hundreds of them so far. And we're creating a sanitation course to go along with it, as well as a whole program on humanitarian engineering that we hope to deploy next year. At this point, speaking of humanitarian engineering, what I want to do is talk a little bit about humanitarian engineering, because that's a new idea and I'm trying to formulate some thinking on it. And I think it raises questions that are pertinent to anybody who comes from a technical lens and works on health and human problems. So it's framed as humanitarian engineering, but really applies to anybody who comes from a technical background to a health challenge. Now, engineers and other technical workers, medics and others, right, have been involved in international development and humanitarian efforts since the very beginning of these enterprises, right? Recent years have seen different strands of thinking emerge around appropriate technology, development engineering, engineering social justice, and a concept that I've been trying to develop through our work and guide our work in the Humanitarian Water Engineering Lab is the concept of humanitarian engineering. And there's been some written about it, but not a whole lot. One of the writers that I really like and I've learned a lot from is Brian Reed from Loughborough University in the UK and Emily Faraday from REDAR. REDAR is a registry for emergency and disaster relief engineers in the UK. So they're very practically oriented technical engineers working in the humanitarian sector. They had a paper in the proceedings of the Institution of Civil Engineers in which they defined a humanitarian engineer as being distinct from development engineering in the wider profession in terms of the kind of technical expertise they bring, the ability to work in a specific context related to emergency and disaster relief. And they draw out 3 features that I think make humanitarian engineering different than regular engineering. One is humanitarian ethics. Like, how do we center humanitarian principles and ethics in practical technical engineering and other kinds of technical work? How do we adapt our skills to work in these contexts? And then how do we be effective in very turbulent contexts in which the normal practices of our disciplinary backgrounds, be it medicine, engineering, or nursing or nutrition or whatever else, none of those apply, right? How do we remain effective in those contexts? So here's what is my aspirational view by humanitarian engineering. Humanitarian engineering is engineering that's driven by the core humanitarian principles of humanity, neutrality, impartiality, and independence. It aims to create, test, and scale engineered solutions to pressing health, environmental, and social challenges in deep collaboration with affected communities and frontline responders. What makes humanitarian engineering different is its focus on those principles of humanity and impartiality. It goes where the needs are the greatest, and it designs for difference to reduce those vulnerabilities. And it's engineering that's fit for purpose to deliver efficient, effective, and equitable social technical solutions in highly turbulent contexts. You see that the Dahdaleh Institute thinking coming through there as well. But this is a nice picture so far, but there's some tensions that arise with these humanitarian principles, which are really front and in front of us right now, especially around neutrality. What is the role of neutrality in humanitarian response? There are very good reasons why neutrality emerged as a foundational principle in humanitarian response, going back to the emergence of the International Red Cross. But what we're seeing now in a context in which a lot of the precepts of international humanitarian law are being undermined, global norms are being undermined. We have to think about what does the principle of neutrality mean in this context, right? And I've been, particularly in the face of what's happening in Gaza, there be repeated calls for humanitarians to question how aid is instrumentalized by states in furtherance of their geopolitical aims. That's not a new story. That's been going on for a very long time, but it's reaching such a crescendo now that people are very seriously questioning this now and asking as humanitarians, how do we need to respond and behave? There was an argument put forward in the Lancet by Dahdaleh at Johns Hopkins and colleagues at Yale and other universities and states, questioning, can we really avoid politics in humanitarian response? The principle of neutrality means that we should not comment or advocate a certain position in a conflict, because that is in tension with the principle of humanity, because we may lose access to the population. The argument that they raise is that if our aid is being utilized to further the harm to the population, or if it is preventing us from addressing the sources of the suffering that we are now continuously responding to, are we actually being humanitarian? And can we remain humanitarians if we do not question the political sources of the suffering that we're trying to respond to? So they ask a really profound question, I think, to humanitarians, asking what state interests, power structures, and voices do you uphold, and whose do you minimize in the response that we undertake? Politics and humanitarianism cannot be avoided, nor should it be. And this is something that I've seen time and time again in the development sector and the humanitarian sector. And I have to make a confession, is that I started my work in the development sector, and I sort of ran away from it, because I ran away, I don't want to deal with those questions of what is the role of institutions? What is the role of government? What is the role of different stakeholders in creating the situation and perpetuating it? I don't want to deal with this question. So I ran away to humanitarian response, because in an acute situation, you can give some water, you can give some food and medicine, and you feel good. But if you keep doing that for decade after decade after decade, and the problem's not going away, the question still comes back. So I've been thinking about, how do we as technical workers in global health or in engineering or medicine or anything else, how do we speak out and render visible those structures of oppression that create the sources of oppression that we're trying to contend with, right? So how do we engage the technical in the political? That's the question, right? I think to the work of William Fisher, who was an anthropologist at Harvard, who did a lot of work on the international development sector and the human systems of international development. And in his assessment, there were two large approaches that NGOs working in international development, but you can extend that to, it's actually mostly in international development, less so in humanitarian, because you'll see why. There are two approaches. The one is the instrumental approach, which sees a primary mode as provision of basic services. So water, food, shelter, things that sustain life, well-being, and preserve the dignity of vulnerable populations. And I like to make the connection, I call it instrumental technical, to make that connection to the technical.
Just for my, yeah. time, and we want time.
Oh, time for questions. So I'm gonna put this out there. And then the other approach is a moral political change approach, which sees engagement as core as changing and challenging relationships of power. And here the purpose is to shift the moral discourse and reimagine what is politically possible. Now, what I think is really compelling is that, I'm gonna skip that rendering technical bit. At the very least, what we can do, I think, as humanitarians, is ground the instrumental technical work in the social political roots that created that situation in the first place. So I think we always have to speak truth about what it is we're putting a band-aid on, what caused it. And this is something that drew me to MSF, because MSF has this principle of witnessing, which was to do the medical humanitarian act, but name what was causing it as well, insofar as you could describe it based on what you see, right? Witness what is the source as documented in the medical evidence, right? I think there's actually ways we can go beyond that to actually mobilize the instrumental technical approach to affecting moral and political change. And there's two ways in my life that I've seen it, and I'm interested if there are others that people could think of. One is building tools and data that support and reinforce institutional accountability and drive political action. And a great example of this is water quality test kits developed by a collaborator in India, working with UNICEF. Rural area, development context in India, very poor water quality outcomes, a lot of diarrheal disease, no mortality, but high levels of morbidity. They entered and deploy these hydrogen sulfide test kits, household level, turn a very evocative black when the water is contaminated with fecal bacteria. They use this to go to the government office and say, you're not treating the water. They always told them, no, our data says the water is fine, just drink it, go away. They came armed with those and said, no, it's not. We know it's not safe. You need to do something. Within 6 months, they went from 5% of wells meeting Indian standards to 95%. So you saw very clearly how data, information in the hands of people can drive accountability and political action. Another way I see people in technical backgrounds working is by hybridizing these knowledge systems. Another example from India about dams. Big dam, this is very petite in the development sector in India, going to displace a lot of people, flood a lot of people. They worked, a group of non-governmental engineers worked with local farmers, mapped the terrain, figured out a way to build the same amount of catchment for the reservoirs to generate the power and the irrigation requirements, while not using the worst lands, the most least agriculturally productive lands, and minimizing displacement. So hybridization of local knowledge with technocratic knowledge to create better solutions. That's another way I see people working together. So I'm going to stop there. Thank you very much. If you'd like to learn more, those are our links.
Very good. Excellent. Thank you. So thoughts, comments, reflections? Go ahead. Yes.
Just like.
Nice and loud, because
Oh, sorry,
remember
yeah.
the room is not very good for acoustics.
Okay, sorry. I want you to forget your question because then, anyway.
Sorry.
No. It's, I guess the quick question is, despite data being available.
Yeah.
What have you seen in terms of change from stakeholders such as like institutions or governments being able to uphold accountability a bit better? I know you said you were avoiding that, like just I guess from like a personal journey, but how has that changed given that this is essentially like what is needed in order to reinforce like evidence-based like practices or like policies, right? Yeah.
So what I'm getting from that question is like, what is the role of data in affecting accountability? Or
What has changed given that there's data right now that backs up, like, backs up the research and like what has been, so I guess like you were mentioning a lot about like Laza specifically, and I think in the news, like, and from what we hear, like, of course, like the conditions, especially from like a water sanitation perspective, is obviously like poor and so in many other regions as well. But like how has like I guess data like given that like there's like given that there's data like has helped essentially like push like policies and like governments or institutions to uphold accountability better? Yeah,
I mean, data is one part of the puzzle, right? These are political struggles in which there are many strands coming together, right? There's a really clear example of this right now with the publication of ProPublica yesterday about the testimonies from USAID, the Department of State, Department of Refugees, to the Secretary of State, Anthony Blinken, and his testimony to Congress. He basically lied to Congress, said that the Israeli government is allowing the aid to enter the country, which enables them to then export arms. USAID told them very clearly that the food aid is being blocked at the border. There's clear evidence of that. It was in reports, it was in recommendations and briefs to leadership. That was not translated. Now there's a major political crisis in the United States government around lying to Congress. So yeah, it took a long time, but we see that evidence, you see that data collection on how much food aid is sitting at the border and how much is getting in, having political repercussions. So there are calls now for his, criminal prosecution for lying to Congress, for him to resign, etc. Who knows how far it gets? Because it's a political process. But even there, you can see the role that data and information has.
I'll also kind of engage with this idea of taking the expertise and pushing for ethics and morality within the work that we do. You said that in the beginning of your research, you kind of ran away with it, and now you're pursuing it head on. Do you think that can you talk to the idea of either for approaching the ethics and the morality and the humanitarian aspects of our work differently from different stages in our careers? So like at the beginning, I know some of us focus specifically on this, and so that's not really applying to these, but those who work on water engineering or health and then later on get into ethics, should we be thinking about the ethics the entire time, pushing really hard? Or are there ways to, are there smaller areas to focus on in the earlier aspects? How would you recommend people think about this early in the career versus later in their career when they're more well established?
It's a great question, because what everybody says is like, when they finish their PhD, they wish they had that question at the end, at the beginning, because you learn so much of the process. And I think one of the things you learn is that you really need to embed these principles at the outset, because that changes how you view the problem and what kind of solutions or what kind of questions you're going to answer, right? So yeah, I think you need to have them up front to inform your worldview and your analysis and what you're going to do about it. But you can't get, it can be potentially risky. You can get mired in analysis paralysis, right? You need to also maintain a perspective on what am I going to do about it? What is a critical problem solving approach to this challenge informed by this ethical lens? Because you're going to get there eventually. You may as well start out in the right place, but don't get mired in it. It's a fine balancing act.
I just had a comment, and then we'll go to Emmanuel's question. I think it's a mistake to think of learning as a linear process, and to think of any phenomenon as devoid of ethics. So you don't learn ethics later or even at the beginning so that it can inform how to do every single thing that we do as human beings has an ethical framework. The question is what framework? Or has a moral dimension, a moral meaning to it. But never mind, forget the ethic. It has a moral meaning to it. Everything we do or don't do has a moral meaning to it. And there are many different types of rationales associated with morality. There are many different ways of construing morality. Right? It's not just morality. There's not a universal morality. There are many different ways of thinking about it. Virtue ethics, or virtue morality, consequentialist ethics, or consequentialist morality, deontological. There's many different ways of thinking about this. But the question is, can we understand the rationale that we use either implicitly or explicitly in doing or not doing the thing that we did or did not do? So for example, do we respond to 300 million people in need of humanitarian assistance? Yes or no? We either do or we don't. Well, there's a morality to that situation, and there's a morality to each of the choices. And then there's an ethical framework that can be used to describe a particular moral choice, so that you can understand explicitly what it is that you are doing implicitly. So ethics is a tool. It's not, and we use this word so loosely, right? And we say, oh, ethics, that's not ethical. Well, what do you mean? describe that. What do you mean? What is your argument? What is the evidence? What is the system of morality that you're using to make that judgment? So I argue, and I'm arguing here, that we, especially in a graduate program, we need to inherently recognize the moral meaning of the choices we make, the things we do or don't do. We need to recognize right now, everything we do has moral meaning. Everything. Now, whether we're conscious of it or not is a different question, but it has moral meaning. And it behooves us in an academic environment to recognize that, right? And to implicitly and explicitly in our pedagogy bring a deeply moral and ethical, i.e. explanatory, lens to the things that we're doing. So it is a mistake to think of this as something you add on, or that you only do later on in your career. Like, oh, I've got experience now, I can think ethical. No, everything you do has moral meaning, everything, whether you recognize it or not. And we need to bring that recognition early on and be able to describe that into our pedagogy. Does that make sense? And I'll just let Emmanuel go, and then we'll come back.
Yeah, thank you very much for. I think I cannot overemphasize the importance of this topic. Looking at the global humanitarian situation, what have been the key challenges you have faced in rolling out these two different humanitarian contexts? If you look at the map, you show that most of the areas affected are in the global south. These are places where resources are limited, infrastructures are working, getting data is difficult and all of that. So what has been your experience with regards to the development of this tool and the application of the tool to get the results you're looking for? That's one. The second point, very quickly, is you mentioned the need to engage the political, technical. This is a recurring issue in the humanitarian world. And currently the thinking is not to just focus on the humanitarian situation, but begin to look at the developmental milestones and creating a nexus.
Yes.
What is called the humanitarian development nexus, and making sure that we work with all stakeholders, within the development sector, bringing the two sectors to the table to plan, and then implement together. So that's one approach. The other thing that many countries, especially in the global south, are doing now is to ensure that health issues, including wash issues, become part of all sectors' national development plan, what they call health in all sectors. So the people in education, information, road construction, housing, whatever, need to think about health, in developing their work plans, and that way we'll be able to address issues of development in such a way that we are dealing with some of these known problems with water and sanitation.
And just before you answer,
and so on.
I just say for the sake of the students, Manuel has worked for many years as a medical doctor, infectious disease specialist, epidemiologist, has worked for many years with the WHO on their infectious disease outbreak and management intervention teams, not only at the highest policy level in Geneva, but also in West Africa, in the field for many years. And this man is a man of incredible experience. So for the students, for the PhD students, make sure you talk to this man, and not just today, but over the life of your time here at the Institute. And Emmanuel is involved in our AI for artificial intelligence and pandemic and epidemic preparedness program, and is here at the Institute a lot. So please make sure you reach out to him and just learn and asking questions, very personable, very easy to get along with, and very warm and very kind. And is very willing to share knowledge and experience. So don't miss the opportunity. Over to you.
Yeah. Well, thank you, Mano, for those. Your questions clearly reflect that depth of experience and practical policy mindedness of your background. Let me address the first question about key challenges of the SWOT. So I would say that there were two kinds of themes of challenges we faced. The first challenge we faced was technical in nature, because as engineers, we have lots of good approaches to dealing with water inside pipe networks. So what we do in Toronto or in Tokyo or Manila or anywhere in the world, we understand that really well. No one has ever looked at the question about what happens to water after it leaves the tap. Because in these contexts where much of the engineering work is being done, it doesn't matter. People drink water from the tap. Why do you care what happens afterwards? Anywhere where people are drinking water from intermittent water systems, which is the majority of the world, that what happens to water afterwards really matters for public health. And we've seen many studies now showing that recontamination after treatment, after it leaves the system, the tap, that's what's driving the public health burden. And no one had ever looked at that before. And the technical challenge we face is that all the tools we have as engineers, the formulae and the models we have, only work in closed systems. So we were dealing with a whole new system, an open system, when it leaves the tap. And that presented massive modeling and conceptual challenges. How do we think about this problem? So it took some years to figure that out, and we eventually did. We took methods from pipe networks, established methods, and we adapted them for that open system context. Then we started bringing in machine learning methods because they could help us figure out signals where we don't know what the physical relationship is between parameters. So we brought in these kinds of methods to help us solve that on a technical level. Then we got the tool. That's great. That was the easy part, it turns out. The hard part is actually getting people to use it. Because as you rightly point out, many of our places we work are humanitarian contexts, like they're acute crises. And this will tie into your second question as well. In these contexts, people have a lot of demands on them to respond to X, Y, and Z crisis, like people are dying. Collecting data and optimizing water quality is often a secondary priority. So getting people to integrate it into the normal operations, because the irony still is that they're still collecting the data, but the data doesn't tell us anything. So what we're trying to do is create a system change to say, you have to collect the data for these normative reporting purposes. Just collect it this way, so it also gives you this operational insight that you can then feed back into your programs and improve the public health outcome. So that's the challenge we're facing right now, and trying to scale it and integrate it into the standards and practices and ways of working in the sector. And we're trying to work with WHO and CDC and different institutions in integrating the guidance, the tool into their operations. The question about the nexus and development. Yeah, there's been, as you know, the huge move towards thinking about longer term sustainability of our humanitarian interventions, because the problem was that we would fly in, drop in, and set up these systems that were completely unsustainable, and they would fail as soon as the acute humanitarian response ended. So people started asking the question, how do we sustain the operations of the systems into the future and involve our partners during that period? That's an important thing to do, but I think there's a time and place to do it, because the acute phase still requires people to quickly move, to put something up to save life. And that the burden of disease and mortality is most significant in the beginning. So we have to address that problem first, and then we can bring in the thinking about how do we make this sustainable. So I think there are distinct technical solutions you want to deploy in the acute period, and then that stabilized and transitional period. So figuring what that is out a bit better and coming up with standard practices, I think that's what a lot of people are working on right now. And we're trying to figure out, like, what is our place in that cycle as well.
So I'm going to ask you to
Pause that.
yeah, because we're just about to close now. So first of all, I'd just like to thank Imran for a very good and deeply comprehensive, but also appropriately nuanced presentation. So thank you for that, giving us an overview of what is humanitarian water engineering, or what specifically are you doing or leading at the lab. So thanks for that. You've also, I think, importantly, raised a number of really profound questions around humanitarianism / development. Is there a nexus? Is there not? Should there be? Should there not be? You've also raised the central importance of politics as context for any kind of humanitarian and/or development action. And you've raised some of the real principal challenges around that. The right use of principles, neutrality, impartiality, independence, and humanity. And under what circumstances do these apply or not apply? And I'm just going to end, with two very quick comments on that. Neutrality is not a goal. It's a principle, and it's a principle to guide action. That's what it is. So many individuals and organizations have this deeply confused. They think that they should be neutral because that's the goal. No, it's not a goal. It's a principle, and it's a principle to guide action. Okay? So you must act. You must do according to your primary intention, which is dignity and the irreducible dignity of all human beings. That's the core idea of humanitarianism. Neutrality is a principle that helps you move toward that end. The issue around should we remain neutral, should we not, and the so-called humanitarian dilemma was actually pretty simple. In a war or in a situation of profound political instability leading to remediable human suffering that should not otherwise occur or would not otherwise occur were there not political instability, the humanitarian acts. So one is neutral in terms of the causes of suffering, the causes of war, and also the causes of suffering. So I would actually disagree with a lot of what you said, right, about the relationship between politics and humanitarianism, and about causality and what you do not identify as causal. And so be very careful about. I would quibble a lot with you on that. We are not neutral, however. The humanitarian is not neutral they are neutral about the causes of conflict. So they cannot accuse one, I'm in solidarity with you, I'm not in solidarity with you, you're the good guy, you're the bad guy. No, humanitarian doesn't do that. So you must remain neutral to the causes of conflict, but not the conditions. So in war, there are laws of war around what is mandated by international law for all belligerents in war. What you must do, what you must not do. It's very, very simple. So on those conditions, the humanitarian must, by definition, speak, act, and do to ensure that those norms are practiced and enforced. Must. Now, the only place where one cannot remain neutral or silent is probably the better word around the causes of war is genocide. The only place, because by definition, there is no humanitarian possibility in a situation of genocide. Because by definition, one party or two parties, and in some cases all parties, are seeking the genocide of the other. Right? And there is no possibility, there's no intention of a political space. There's no intention of a future peace. Right? There's no intention of a future political process to which one is using arms for the sake of gaining a stronger or more advantageous political position once that political process begins. That's the vast majority of conflicts. The vast in human history is full of war. It's simply, as Clausewitz very famously said, war is politics by other means. That's what it is in most cases, with the exception of genocide. There's no politics. There's no future politics. The idea is to eliminate. Now, in that case, that's where the humanitarian organization must be definitive about speaking out against the causes of war. And this is tested. I don't mean to go into a long lecture on this, but this was tested very thoroughly with the Red Cross during the Holocaust and during World War II. Red Cross worked in the concentration camps. It knew what was going on. And for 70 years after the war, and after the Holocaust, they said, no, we were neutral, we could not get involved, that was politics, that's what neutrality means, right? But 70 years later, the Red Cross after deep reflection and internal debate and discussion and so on, 70 years later, the Red Cross officially apologized to the World Jewish Congress and publicly apologized for its mistake, its wrong in not recognizing its moral obligation to speak out against genocide that was taking place in the extermination camps. And that has subsequently affected the Red Cross policy, so that they've only spoken out once, as far as I'm aware, and I don't quote me on this, but they've only spoken out once since that time around the condition, around the causes of war. And this was the genocide in Rwanda. So this is a big area, and it's not something that we can just kind of, lightly throw around and sort of say, oh, it's a great idea, well, we should look at it. This is a very serious, and I think you've seen very nicely in Imran's presentation, just how serious this is. This is very complex, that the morality and the ethical choices that one makes based on moral frameworks in war and in crisis. This is extremely complex to understand it, right? And it's not simply a throwaway kind of comment, which we often hear in public discourse, and we often hear from major organizations, development and humanitarian organizations. We treat these issues, at least in a public way, in a far too cavalier way, and leading them to the kind of bemused confusion in the public's mind around these kind of issues. So I just want to thank you, Imran, for a great presentation, a great overview of humanitarian water engineering, a great introduction to the relevance of politics to intervention, whether it's development or humanitarian, and also a great invitation to more thoroughly explore humanitarian principles, practices, morality, and ethics. So thank you.
Thank you as well. Yeah.
Excellent. So officially, our seminar is now over.